pain and the discomfort and leaving work, I knew that there was something wrong.
So I thought maybe I might even have cancer.
I hope that something will be done about it, that I'll feel better. If I don't, I just hope that it doesn't get any worse than it is now.
The people you've just heard from suffer the pain and anxiety of irritable bowel syndrome, also known as IBS. This common intestinal disorder strikes more than 1 in 10 people. Some experience diarrhea, others are constipated. IBS has been called many things: spastic colon, mucus colitis, or motility disorder. Doctors can't say for certain what causes it or how to cure it, and that can lead to frustration for patients, families, and friends. There is treatment, and although the symptoms can persist, IBS is not life-threatening. In this video, you will hear from patients who cope with IBS and from medical experts. It's a 6-step journey to a better understanding of irritable bowel syndrome. Dr. Grant Thompson is a professor of medicine at the University of Ottawa. He is a gastroenterologist internationally recognized for his expertise in IBS.
These symptoms are primarily abdominal pain, abdominal bloating, and chaotic bowel habit. The pain is related to defecation usually, in that the person notices a relief of pain with defecation or a change in the consistency or frequency of bowel movements after the pain onsets. Other symptoms such as mucus in the stool or a feeling of incomplete bowel movement are also features of the IBS that help the doctor recognize this syndrome.
Psychologist Dr. Brenda Toner is with the Clark Institute at the University of Toronto. Internationally recognized, she specializes in the field of irritable bowel syndrome.
We know that living with IBS can severely compromise quality of life. For example, living with chronic and unpredictable pain and diarrhea is not easy and can interfere with work and social activities.
There are no tests that positively identify irritable bowel syndrome. Doctors can often make the diagnosis after taking a careful patient history and completing a physical examination. Your doctor may order tests to rule out coexisting diseases that may be suspected, and that's where the frustration sets in for many patients.
After having several tests done on my stomach and whatnot, I wondered what really was the problem, because everything kept coming up normal, but I was still having all these symptoms.
Well, there are no tests that will positively identify the irritable bowel syndrome. Therefore, your doctor would only order tests on you if he was concerned about the possibility of some coexisting disease. In an older person where other coexistent diseases are more likely, your physician will usually wish to rule out these coexistent conditions. Now, the symptoms that we've described for you as those of the irritable bowel are not those of colon cancer, but it can exist as an early stage, and most doctors would like to get either a barium enema or a colon endoscopy done. Now, the barium enema is performed by injecting barium into the rectum and outlining the entire large bowel. This can rule out the presence of any cancers. The other test of the large bowel is to insert a long tube with a light on it, and the operator can then observe the inside of the bowel and exclude any local disease.
IBS is a common disorder, despite its low profile. Attacks can occur at any age, but symptoms usually appear in early teens and can last years. There is no simple explanation of how IBS begins. However, food and stress are known triggers.
When I'm under stress, the bloating, the constipation, and different other aspects of the syndrome seem to get affected more through my stress.
A helpful way to understand the mind-body association as it relates to bowel function is through the concept of brain-gut connection. For example, under stress, the brain may send messages to the gut that heighten the sensitivity of gut nerve receptors.
Many researchers have come to the view that the gut is hypersensitive, and there's some data to support that. For example, in some people, the act of eating can cause abnormal movements in the gut or abnormal reactions in the gut when compared to normal people.
Science doesn't support the notion that food causes IBS. However, health experts agree food can aggravate the disorder. The list of probable culprits includes caffeine, alcohol, artificial sweeteners, and preservatives.
The good news is that there are a variety of treatments available that have been shown to be successful in improving symptoms. These include dietary or lifestyle changes, pain or stress management techniques, over-the-counter or prescription medications, and various forms of psychosocial therapies.
Unfortunately, there's no drug that can cure or make better all the symptoms of the irritable bowel syndrome. And indeed, if you're a young person, you don't want to be on drugs for long periods anyway. On the other hand, if there's a particular symptom that's troubling you greatly, your doctor may be able to help you with a certain drug. For example, if diarrhea interferes with your life so that you can't go to work or are forced to miss social occasions, an antidiarrheal drug may help you on those events and prevent you from having to stay home. Most people with the irritable bowel syndrome at some time or other are constipated. Using a bulking agent such as bran or Metamucil can prevent this part of the irritable bowel syndrome.
The choice and success of these treatments depends on the severity of the symptoms and the triggers that aggravate the bowels. You have to find the right approach tailored for you.
I have to learn how to take care of myself, and if I don't take care of myself, then I get attacked, from the inside out. So it's kind of in my hands just how life and what I do to myself is going to affect me.
But I hope I'm going to be able to find a suitable management for it.
Irritable bowel syndrome can be embarrassing to talk about. Few people are comfortable discussing it as they would a headache. This can lead to even further stress for patients. Doctors admit they don't fully understand IBS because there are no clear abnormalities in patients. From this uncertainty grew the myth that irritable bowel syndrome must be an imagined disorder, suffered by people who don't need medical attention, but psychological help.
There's nothing worse than thinking that people are looking at you and you're not really sick. You're faking it, or you've got a mental problem.
Many times I've had the feeling that I felt the doctor or my family thought many of these problems were in my head.
We need to educate healthcare professionals to recognize that the trivialization of IBS in our healthcare system and the stigma of bowels in our society can cause frustration and distress in patients who suffer from IBS.
Now, headaches are something we all appreciate and talk about in polite company as compared to the bowel, which we tend not to talk about very much in company. Therefore, we seem to have a better acceptance of headaches. Headaches can cause pain. This pain can be very severe, yet there's no abnormality, no structural abnormality of the head that can explain the headaches. And one can have pain and bloating and other symptoms emanating from the gut with no clearly discernible abnormality present.
Irritable bowel syndrome is a very real yet benign condition. Although many patients fear it is a precursor to cancer, they are at no more risk than anyone else. So what lies ahead? Before you resign yourself to a lifetime of discomfort, talk with your physician and create a shared plan of care. Let's review what we know about irritable bowel syndrome. The symptoms vary from patient to patient. There are no tests that positively identify it. It can strike at any age, but usually begins in the teenage years. Although a cause cannot be pinpointed, a number of factors aggravate the illness. food, and stress are the most commonly identified influences. There is no miracle cure, but there are treatments to improve your health. They include a change in lifestyle or diet, stress management, medication, or therapy. Learn to talk more openly about irritable bowel syndrome to relieve some of the stress associated with having an embarrassing illness. Talk with your physician about your health. This video is just one resource you can use to help you understand and cope with a troubling but treatable illness.